Welcome at our superfood channel for cats. Today we will talk about anemia in cats. My name is Rob. I am author of dozens of pet books sold in more than 25 countries. If you have any questions or remarks or additions, leave a comment and I will respond. Did you know that anemia is a common condition in cats? But what exactly is anemia? Anemia in cats, a condition marked by a deficiency of red blood cells or hemoglobin in the bloodstream. This deficiency can lead to reduced oxygen carrying capacity and impaired circulation, impacting a cat's health and well-being significantly. But it's not just one size fits all. There are different types of anemia. Some cats may have regenerative anemia, others may suffer from non-regenerative anemia. Each type of anemia has its unique causes and symptoms. In the next few minutes, you'll gain a deeper understanding of anemia in cats, its symptoms, causes, and treatment options. So stay tuned as we delve into this complex but important topic. First, let's delve into the different types of anemia that can affect our feline friends. Anemia is not a disease in itself, but a symptom of an underlying condition. And it comes in two main types: regenerative and non-regenerative. In regenerative anemia, our cat's body is doing its best to fight back. This type of anemia occurs when the bone marrow responds to the loss of red blood cells by ramping up production. Picture it like a factory working overtime to replace lost goods. But what causes this increased demand? It could be blood loss due to a nasty trauma, an infestation of parasites, or even an underlying disease that's causing the red blood cells to be destroyed faster than normal. On the flip side, we have non-regenerative anemia. This is when the bone marrow isn't able to produce an adequate number of red blood cells. In this case, the factory workers are on strike and production is down. The causes here are often more chronic or severe, like long-term diseases, bone marrow disorders, or nutritional deficiencies. It's like trying to build a house without enough bricks. Now, it's crucial to understand that these two types of anemia are quite different in their causes and potential treatments. Regenerative anemia is a sign that the body is actively trying to fix the problem, and with some help, it just might succeed. Non-regenerative anemia, however, is indicative of a more serious condition that can be difficult to treat. It's also important to remember that anemia is not exclusive to cats. It can affect any animal with blood, from dogs to humans. But for our feline friends, being aware of these types of anemia and their causes can help us take better care of them. So depending on the cause, anemia in cats can either be regenerative or non-regenerative. But how would you know if your cat is suffering from anemia? Recognizing the symptoms of anemia in cats is the first step towards getting them the help they need. Anemia can manifest in several ways. Your cat may show signs of weakness or lethargy, a lack of energy that's harder to shake off than typical cat naps. Alongside this, you might notice a decrease in appetite, which could lead to weight loss if not addressed promptly. Look closely at your cat's gums and lips. If they're paler than usual, this could be a sign of anemia. In more severe cases, a yellowing of the skin and eyes, known as jaundice, might occur. This is due to an excess of bilirubin, a waste product usually processed by healthy red blood cells. You may also notice an increase in your cat's heart or respiratory rate, or an intolerance to exercise. These are all signs that your cat's body is working harder to distribute oxygen. If your cat exhibits any of these symptoms, it's crucial to get them checked by a vet as soon as possible. So you've noticed some symptoms and suspect your cat might have anemia. But how is anemia in cats diagnosed? Well, diagnosing anemia in cats is a multi-step process that requires a combination of physical examination, blood tests, and additional diagnostic tests. Let's dive into this process a bit more. The first step in diagnosing anemia is a thorough physical examination. Your vet will check your cat's mucous membranes, such as the gums and lips. A healthy cat will have pink gums, but in cats with anemia, these membranes might appear pale. Your vet might also check for other signs of anemia, such as weight loss, weakness, or jaundice, which is a yellowing of the skin and eyes. The next step in the diagnostic process involves blood tests. One common test is the complete blood count, or CBC. This test measures the number and types of cells in your cat's blood. A decrease in the number of red blood cells or a reduction in the amount of hemoglobin, the oxygen-carrying component of red blood cells, can indicate anemia. Another test that might be used is serum biochemistry. This test provides information about your cat's overall health and can reveal conditions that might be causing anemia, such as kidney disease or deficiencies in essential nutrients like iron, vitamin B12 or folic acid. But sometimes these tests aren't enough to determine the cause of anemia. In such cases, additional diagnostic tests might be necessary. For example, if your vet suspects that parasites are causing anemia, they might perform a fecal examination, or if they suspect a tumor or organ abnormality, they might use imaging studies like X-rays or ultrasound. These diagnostic steps are crucial in pinpointing the cause of anemia, and as we've mentioned, the cause of anemia can vary widely from blood loss due to trauma, to parasitic infections, to chronic diseases and more. An accurate diagnosis is key to providing effective treatment for anemia. With the right diagnosis, your vet can devise a targeted treatment plan to address the underlying cause and alleviate the symptoms of anemia, helping to improve your cat's health and well-being. Once diagnosed with anemia, what's next for your cat, you might wonder? Well, the treatment options for anemia in cats are as diverse as its causes. The guiding principle here is to address the root cause and the severity of the condition. For instance, if blood loss is the issue, blood transfusions can be a lifesaver, replenishing the lost red blood cells. If an underlying disease or infection is at play, the appropriate medications will be administered to your cat. And in cases where nutritional deficiencies are the culprits, your vet may recommend specific supplements to correct the imbalances. Remember, parasites can also cause anemia, so managing these pesky invaders is crucial too. The journey to recovery might seem daunting, but with a dedicated veterinary team and a tailored treatment plan, your cat can effectively manage anemia. The goal, to improve their health and quality of life. With the right treatment, anemia in cats can be effectively managed, improving their health and quality of life. Anemia in cats is a complex condition, but with understanding and early detection, it can be managed successfully. Today, we've learned about the two main types of anemia in cats, regenerative and non-regenerative. We've delved into the multitude of symptoms that might indicate anemia, such as pale gums, lethargy, and a reduced appetite. We've also discussed the various treatment options available, which depend on the underlying cause and severity of the condition. These can range from blood transfusions to nutritional supplements and from medications to parasite management. The key point to remember is that regular veterinary checkups and preventive care are vital. These can help detect and manage anemia early, leading to better outcomes for our feline friends. Remember, the health and well-being of your feline friend is in your hands. Stay informed, and together, we can help our cats lead healthier, happier lives. If you found this video helpful or interesting, show some appreciation by hitting the like button and subscribing for more. This helps us a lot so we can make more informative videos about cats.